Well, good afternoon. Thank you for having me here. My name is Cindy Comella. I'm a neurologist specializing in movement disorders at Rush University Medical Center. I'm wearing the white coat because I'm a very bad actress, so that way you'll recognize that I'm supposed to be playing the doctor part. But Sheryl, on the other hand, who has really been incredible insofar as putting this together, she has no problem with acting, so so we'll take it from there.
I'm Sheryl Jedlinski, co-founder of PD Plan for Life and Cindy's #1 fan. She is my neurologist, my psychologist, my friend, and my alter ego. She is a researcher, a professor, a member of numerous professional boards. In short, she's a neuro rock star.
And I promise I won't sing. Sheryl is my friend, she's my patient, and my ego booster, as you can tell. She's very talented and an astute observer and describer of life. She's very accomplished and has written numerous articles about her disorder that have appeared in newspapers and magazines across the country. She's taught me a lot about what it means to have Parkinson's disease. She has made me a better doctor, and she has kept me honest.
In the interest of full disclosure, I must tell you that I paid Cindy to say those nice things. Cindy and I have been together for 12 years, outlasting many marriages. We didn't meet on eHarmony or Match.com. We met the traditional way through a referral by one of the national Parkinson's orgs. Having broken up with 2 doctors in the space of a year, I no longer had faith in my own ability to find Dr. Right.
Reaching out to professional matchmakers seemed the only remaining option. Seeing how many families, friends, and neighbors typically don't have a neurologist amongst the repertoire of physicians that they see, rather having pediatricians and gynecologists. So it takes a particular type of referral in order to find the right doctor in neurology.
Did I prefer a doctor who had a good bedside manner or strong technical skills, they asked me. Well, what kind of question is that? Don't we all want somebody who has both? When I met Cindy, I found that you don't have to settle for less than that. She has it all.
And I paid Sheryl big bucks to say that.
From the moment I saw Cindy stride confidently into the waiting room on her 3-inch heels, which otherwise were the same height, greet me by name, flash a disarming smile, and extend a firm handshake, I knew that ours was a match made in heaven. Then Cindy ruined the moment by confirming my worst fear. She told me I had Parkinson's disease.
Giving the diagnosis of Parkinson's disease is one of the most difficult things that I have to do.
Let me tell you, getting that diagnosis is no picnic either, no matter how compassionately the news is delivered. No one wants to hear that they have a progressive, incurable disease.
Observing and accepting this kind of news usually takes time. Typically, I'll ask someone who's newly diagnosed to return in about 8 to 10 weeks. Not because we're going to initiate treatment, but because often during that time, that's when the unanswered questions come up, and that's when the sort of the stark realization of what's been said hits. I bring them back and I assure them that we have treatments that can help them continue what they enjoy doing for many years to come, and that research is already underway and very likely to lead to new treatments that provide better symptomatic control and hopefully at some point in the future, the cure.
When Cindy first diagnosed me, she told me the cure was 5 to 10 years away. It's been 12 years now. There's no package at my doorstep. Apparently her crystal ball was a little foggy.
As you can see, Sheryl does not miss an opportunity to remind me that my promise date for the cure has come and gone, and she's still shaking.
Every visit, I greet Cindy with the same question. found a cure for me yet. Isn't this our first thought every morning as we struggle to get out of bed, and our last as we crawl back in at night?
That's what I like about our relationship. No pressure. I tell Sheryl she has a good many years ahead of her, and that working as a team, we can keep her focused on the business of everyday living and not have Parkinson's disease run her life.
And Cindy is right about that. Since my diagnosis, I have celebrated our sons' graduations from college and law school, danced at one's wedding, welcomed a wonderful daughter-in-law and 4 granddogs into our family. I have discovered things about myself I never knew, done things I never would have expected to accomplish, and forged friendships with people I otherwise would not have met. And as an added benefit, I basked in earlier than planned golden years with a man I love more today than I did when we met in college 37 years ago. How well you live with Parkinson's is up to you.
So Sheryl, what is your secret for living with Parkinson's disease for 12 years?
I have no secret, no special powers, and no kryptonite. I keep up with daily Parkinson news and research online and try to do what is said to be most effective in helping us remain active and independent. This includes developing a good relationship with your doctor based on trust, openness, and good communication. Exercising daily, that'll be a topic later, and maintaining a positive attitude and a determination to overcome all obstacles in my path. And if I can do these things, so can everyone else in this room.
Studies have shown that patients with chronic illnesses who develop relationships with their doctors tend to fare better over the long run. The fact that they share in the decision-making process makes them more likely to adhere to treatment plans, take prescribed medications, and results in better symptomatic control and improved coping ability.
When choosing a doctor, look for a neurologist who specializes in movement disorders and keeps up with the latest research, treatment innovation, and clinical trials that may give you access to promising new drugs not yet available to the general community. Depending on where you live, you may have to travel to find a movement disorders specialist, but he or she should be able to come up with a plan and refer you to a doctor close to your home who can administer it. Remember that you are putting your quality of life into this person's hands. So if you have to travel a little bit once a year, it's well worth it.
How will you know when you have found the right doctor? Well, you don't have to share a love for walking on the beach or traveling to exotic places.
You just need someone who
is empathetic, compassionate, supportive, and cares about your well-being.
Makes you feel heard and understood.
Listens and takes care of your concerns seriously, treating you with respect.
Communicates in terms you understand, inspiring your trust and confidence in their ability to problem solve.
Encourages you to learn all you can about Parkinson's and to ask questions if you don't understand something.
Empowers you to take charge of your health, selecting treatments with and not for you.
And Sheryl, you forgot to mention cure Parkinson's disease.
That was for extra credit, because my father always told me to shoot for the moon.
Settling for someone less than Dr. Wright can be bad for you and your health. Surveys reveal that the stronger the personal connection between patients and doctors, the better care a patient can receive.
I broke up with 2 doctors before I met Cindy. The first was an internist who was not the least bit concerned that my left pinky had begun tap dancing on the kitchen table without my say-so. In fact, he was condescending enough that he told me it was attributed to my being a middle-aged woman about to become an empty nester. Why then, I wondered, in the immortal words of Jerry Lee Lewis, Wasn't there a whole lot more shaking going on among my friends?
Things are no better when Sheryl moved on to a general neurologist who told her that at age 44 she was too young to have Parkinson's disease.
He obviously had not read Michael J. Fox's coming out story on the cover of People magazine in his own waiting room. This did not inspire my trust or confidence, so I resumed my search for Dr. Wright. But this took me back to my teen years, when my grandmother would assure me that every pot had its cover. Not only was I dateless, I felt like a cast-off piece of non-stick cookware awaiting my lid. Not quite as romantic as the Cinderella story.
Each patient is unique and requires a doctor with a different personality or demeanor and relationship style. Many times as I talk with a patient about different kinds of treatments, they'll look at me and they'll say, well, you're the doctor, you decide. Sheryl, of course, has never once said that.
No. The traditional doctor-patient relationship in which the doctor leads and the patient follows blindly without asking any questions, definitely not my style. I much prefer our partnership in which we share the responsibility for making decisions about the course of my treatment.
So Sheryl always arrives for her appointment with a list of questions and a ream of articles from the internet. It's true.
I don't want to take a chance that Cindy may have missed some news that I consider important and worthy of discussion. Some doctors have no patience for this, but Cindy is always up for the challenge.
I admire Sheryl's commitment to learning all she can about her disease and appreciate that I learned something from our discussions as well. Sometimes I feel like I did in college, that I better pull an all-nighter with my colleagues before an appointment with Sheryl.
Sometimes Cindy has to remind me that what works for one person may not work for another, seeing as how Parkinson's is a designer disease with symptoms, rate of progression, and degree of disability varying from person to person.
If someone tries to sell you the cure, be very skeptical. We sure wouldn't be the last ones to find this out, although Sheryl may be the first one to find this out.